Ever feel like healthcare costs are just kind of a black hole, just eating up more and more money, and you never really know why?
Yeah, definitely.
Well, on this deep dive, we're going right to the source, into the world of UnitedHealth Group,
Mm-hmm.
one of the deepest players behind the scenes of American healthcare.
I think a company that a lot of people interact with more than they even realize.
Yeah.
Yeah.
So let's take it back a bit.
Okay.
UnitedHealth Group, this huge company, this conglomerate, it wasn't always like this.
Right.
So where did it all begin?
Well, it's kind of a classic story of starting small and then scaling up.
Okay.
But of course, there's some bumps along the way.
Of course, yeah.
Back in 1977, it was just this little company called CharterMed focused on a pretty specific type of health plan just in the Midwest.
Wow. And from that, they ended up as like the 9th largest company in the whole world by revenue?
Yeah.
That's incredible. What was the secret?
I mean, strategic mergers and acquisitions played a huge role.
Okay.
By the late 90s, they'd become UnitedHealth Group as we know it today, with that kind of parent company structure
Uh-huh.
and different branches all tackling different parts of healthcare. So,
So that explains why they seem to be everywhere.
yeah,
But I'm guessing along the way, all these mergers, they weren't always popular.
you're right. There were definitely some legal challenges and controversies,
Oh, yeah.
accusations of all sorts of things, from manipulating data to straight up overbilling. And those issues, they're still around today.
Okay, that's a lot to get into.
Yeah,
But before we get into the messy stuff,
right.
can we just break down the basics of how UnitedHealth Group is structured right now?
Yeah, absolutely.
Like, what are the different pieces?
So the two biggest names under the UnitedHealth Group umbrella are, of course, UnitedHealthcare. That's the insurance giant everyone knows.
Yeah.
And then there's Optum, which is a little more behind the scenes, but honestly, I think even more powerful.
Okay, so let's start with Optum.
Yeah.
What is it exactly that they do? Because the name doesn't really tell you much.
Yeah, that's true.
What is it?
So Optum, it's actually divided into three main divisions: Optum Health, Optum Insight, and Optum Arcs.
Okay.
Optum Health is the part where they're actually delivering healthcare services.
Okay.
Think clinics, surgery centers, even telehealth.
Oh, so it's not just managing insurance anymore.
Right.
They're becoming the healthcare providers, too.
Yeah, and this is a trend you see more and more in the healthcare industry.
Oh, wow.
These companies own both the insurance and the provider side.
Well, isn't that kind of a conflict of interest?
Yeah, it definitely blurs the lines.
Yeah.
And it's a trend that a lot of people are concerned about because it consolidates their power
Uh-huh.
and it could really limit patient choices.
Yeah, that's a little concerning.
Yeah.
Okay, well, what about Optum Insight? What's their deal?
So Optum Insight, think of them as like the brains of the operation.
Okay.
It's all about data analytics.
Okay.
Crunching numbers to help hospitals and insurance companies run more efficiently.
Okay.
So they're the ones behind the scenes shaping decisions about healthcare costs and how to allocate resources.
So they have a lot of influence.
Oh, yeah, data is king these days.
Yeah.
But all this number crunching, it makes you think about those accusations of data manipulation.
Oh, right. You mentioned those before.
Yeah.
So is it possible that they're not just looking at the data, but they're actually using it for their own benefit?
Well, you're right to be skeptical.
Yeah.
Optum Insight and its predecessor, Ingenix, have been accused of doing exactly that.
Oh, wow.
Using data to underpay claims and even to misrepresent how much healthcare really costs.
So they're taking something that's supposed to be objective,
Right.
data, and spinning it their own way.
It's a great example of how even objective data can be, spun and manipulated to serve certain interests.
Mm-hmm.
And in this case, those interests might not be what's best for the patient.
Right.
Or even for the healthcare system as a whole.
That's pretty scary.
Yeah,
Okay, so we've got Optum Health, Optum Insight, and then there's Optum Arcs.
right.
What's their role in all this?
So they're the ones dealing with your prescriptions.
Okay.
They negotiate drug prices and manage pharmacy benefits for millions of Americans. They're essentially the gatekeepers between you and your medication.
So that's why my allergy meds cost so much.
Well, maybe.
But seriously, that's a huge responsibility.
Right.
Are they doing a good job keeping prices down for patients?
That's a question that's been debated a lot. Like
Yeah.
other pharmacy benefit managers, they've faced criticism for not being transparent about their pricing practices.
Oh, so it's not really clear how they decide what to charge.
Right. Critics say they're more focused on profits than on affordability for patients, that they're pocketing rebates from drug companies instead of passing those savings on to the people who need the drugs.
That's frustrating.
Yeah, and there's definitely been pushback. Government agencies like the Justice Department, they've investigated UnitedHealth Group,
Okay.
and they've even tried to block some of their mergers
Oh,
because they're concerned about monopolies and unfair competition.
so they're not just getting away with all of this.
Well, so far they've been pretty successful at navigating these legal challenges.
Oh, wow.
Yeah.
So they're this big, powerful company with tons of money and influence,
Uh-huh.
But they've definitely been involved in some shady stuff.
Yeah, a lot of controversy.
Where do we even start?
Well, the Ingenix scandal we talked about earlier, that was a big turning point.
Right.
They ended up settling a huge class action lawsuit because they manipulated data to deny claims.
Wow.
And that was really just the beginning.
What else have they been accused of?
Well, there have been accusations of overbuilding Medicare,
Uh-huh.
questionable practices with their Medicare Advantage plans,
What?
even accusations of racial bias in the algorithms they use to decide patient care.
Wow. It's a lot to take in.
It is.
It makes you wonder about all those donations they make, like through the UnitedHealth Foundation.
Yeah.
Are they really trying to help? Or is it just a PR stunt to cover up all these problems?
It's a good question.
Yeah.
They've donated millions to healthcare causes, especially in underserved communities.
Yeah.
And they've pledged money to diversify the healthcare workforce.
Okay.
So I think it's up to each individual to decide, do those actions outweigh the ethical concerns about how they do business?
It's definitely complicated.
Yeah.
And on the topic of complicated, we have to talk about what happened in 2024.
Right.
Starting with that cyber attack on Change Healthcare, a company they just bought.
Yeah, it was a mess.
It really caused chaos.
Yeah, it crippled healthcare payments across the country.
Yeah.
It really showed how vulnerable our increasingly digital healthcare system is. And it put UnitedHealth Group right back in the hot seat.
Oh, how so?
The Justice Department started new investigations into their practices.
Wow, so this wasn't just a random cyber attack.
Right.
It was because of something UnitedHealth Group did.
Well, the timing definitely raised eyebrows.
Okay.
Critics argued that the acquisition itself, which the Justice Department had tried to block, made them more vulnerable to this kind of attack. So, yeah, some people are saying it's a direct consequence of UnitedHealth Group's control over the healthcare system.
So they get bigger and bigger. And then something like this happens, and it affects everybody.
Right. It highlights the risk of putting so much power in the hands of one company.
And what did UnitedHealth Group do after the attack?
Well, at first, they tried to downplay the impact. But as things got worse, they eventually paid billions of dollars to providers to try and help with the financial strain.
But I bet the damage was already done.
Yeah, it definitely was.
Did anything change because of the attack?
Well, it definitely made everyone more aware of cybersecurity risks in healthcare.
Okay.
And the Justice Department is still investigating.
Yeah.
But it's hard to say what the long-term consequences will be.
Yeah, it's a reminder that even these giant companies, they're not invincible.
Right.
And when they mess up, regular people pay the price.
Exactly.
Okay, so we talked about the cyber attack, but then, just a few months later,
Yeah.
the CEO of their insurance division, Brian Thompson, he was killed.
That was a shocking event.
Really shook things up.
Yeah, it did.
It's hard to believe that someone would target a healthcare CEO like that.
It's really awful.
Do we know why it happened?
So the person who was arrested, Luigi Mangione, he had a history of mental health issues. And it seems like he had some kind of personal grudge against the healthcare system.
Oh, wow.
But what's interesting is that his actions really sparked this bigger conversation
Yeah.
about how health insurance companies affect people's lives.
Yeah, it feels like even though what he did was wrong, it resonated with people.
Right. On social media, so many people were sharing stories about their bad experiences with UnitedHealthcare,
Yeah, I saw some of those.
talking about denied claims, crazy high costs.
Yeah.
Feeling like they're just a number in the system, you know?
Yeah.
Like no one cares.
It's really sad, a tragedy on so many levels.
It is.
Not just that someone died, but that people have lost faith in the system that's supposed to take care of them.
Yeah.
And Brian Thompson, since he was the head of the insurance division, he became a symbol of everything that's wrong.
I think so.
Even though he was just one person in a giant company,
Right.
it really shows how disconnected the corporate side of healthcare is from the human cost of their decisions.
It does.
So where does that leave us? What's the takeaway from all of this?
I think it brings up these really important questions about the future of healthcare in America.
Yeah.
Like, can companies like UnitedHealth Group, with all their power and influence, actually be part of the solution?
Right?
Or are they always going to be part of the problem?
That's what we're going to look at in the last part of our deep dive.
Yeah.
We're going to look at what happens. They keep getting bigger and bigger.
Mm-hmm.
And what, if anything, can be done to make healthcare more fair and affordable for everyone.
It's a big question.
Yeah,
A lot to think about.
it is. And to think we've only just scratched the surface.
Yeah.
But before we get into all of that, let's take a step back
Okay.
and look at the man who built this whole thing. Richard Burke, the founder of UnitedHealth Group.
He's an interesting figure.
Yeah, so let's talk about him.
Yeah, Burke's story is pretty fascinating,
Oh,
actually.
yeah.
He wasn't a doctor or anything. He started out in finance.
Oh, really?
But he saw potential in this new thing, HMOs, health maintenance organizations.
Uh-huh.
And he took a gamble, a big one, and it really paid off.
So he was a businessman first.
Yeah.
That explains the whole aggressive growth strategy.
Yeah, definitely.
But what about the hockey team thing?
Oh, right.
What was that all about?
It's kind of a side story, but I think it tells you something about him.
Okay.
He was a big hockey fan, and he saw an opportunity to move the Winnipeg Jets. They were struggling,
Yeah.
so he brought them to the U.S.
And that's how we got the Arizona Coyotes.
Exactly.
So he was a risk taker.
Oh, yeah.
Not afraid to make bold moves.
And not just in healthcare.
And that boldness, it worked for UnitedHealth Group, right?
It did for a while.
But it also got it into trouble.
Yeah, you're right.
Didn't he have some legal issues with stock options or something?
Yeah, when he left UnitedHealth Group in 2006,
Uh-huh.
there was a lot of controversy.
Oh, about what?
Stock option backdating, basically manipulating the dates to make more money.
Wow.
He ended up paying a lot of money to settle with the SAC and shareholders.
So his legacy is complicated.
Definitely a mix of good and bad.
Yeah, innovation, huge success, but also some questionable choices.
But you can't deny he built a company that changed healthcare in America.
Yeah, no doubt about that.
And that brings us back to where we are now.
Okay.
Burke's gone, but UnitedHealth Group is still dealing with the fallout of his decisions.
Right.
And trying to navigate this crazy healthcare landscape.
Okay, well, let's get back to that cyber attack on Change Healthcare.
Yeah.
It really threw everything into chaos.
It did.
What exactly happened?
So early 2024, hackers targeted Change Healthcare. They processed tons of healthcare transactions.
Right?
And the attack shut down their systems for weeks.
Wow.
Payments were disrupted, care was delayed. Some people even worried about their data being stolen.
And this was right after UnitedHealth Group bought them, right?
Yeah, just a few months after.
What a mess. What bad timing.
The timing definitely made people suspicious.
Yeah, I bet.
Critics were saying that the acquisition itself made them more vulnerable.
Because?
Well, the Justice Department had tried to block the deal. They were worried about it creating a monopoly.
Okay.
And some people are saying that this vulnerability, this weakness that the hackers exploited, it was because UnitedHealth Group got too big.
So they're so focused on growing.
Right.
And then something like this happens.
And it affects the whole system.
Yeah, it's kind of scary.
It highlights the risk of having one company in control of so much.
So what did UnitedHealth Group do? Did they take responsibility?
Well, at first they downplayed it.
Oh, really?
Yeah, but then as the fallout got worse, they ended up paying billions of dollars to providers
To make up for it.
to try and help them financially, yeah.
But even with the money, there must have been lasting effects.
Oh, yeah, there was definitely damage done.
So did this change anything?
Well, people in healthcare are definitely more aware of cybersecurity now.
Okay, that's good.
And the Justice Department is still investigating. So we'll see what happens long term.
It's wild to think that even a giant company like that could be so vulnerable.
Right.
And when they make mistakes, regular people suffer the consequences.
Yeah, that's the scary part.
Okay, well, let's talk about the other big event of 2024.
Ryan Thompson?
Yeah, his death, that was a real shock.
It was a tragedy.
It's just hard to believe that someone would target a healthcare CEO like that.
Yeah, it's really awful.
What do we know about why it happened?
So the guy who was arrested, Luigi Mangione, he had a history of mental health problems.
Okay.
And it seems like he had some kind of vendetta against the healthcare system.
Wow, so it was personal.
It seems that way.
But you said before that his actions started a bigger conversation.
We did, yeah.
About what?
About the role of health insurance companies.
Okay.
How they affect people's lives.
And how is that connected to this tragic event?
I think even though what Mangione did was wrong,
Right.
it resonated with people.
Oh, I see.
On social media, you saw all these people sharing their own stories.
Yeah, about their own experiences.
Yeah, bad experiences with UnitedHealthcare specifically.
Like what?
Denied claims, high costs, just feeling ignored.
Like they don't matter.
Exactly. Like they're just a number in the system.
It's heartbreaking.
It is.
So it's a tragedy on multiple levels, you know?
Yeah.
Not just the loss of life, but the loss of faith in the system.
Yeah.
The system that's supposed to take care of us.
Right.
And Brian Thompson, because he was in charge of the insurance part,
Yeah.
he kind of became the face of everything that people hate about the system.
It's true, even though he was just one person in this huge company.
It shows how disconnected the corporate world is from the real people their decisions affect.
It really does.
So where does this leave us? What did we learn?
I think it raises huge questions about the future of healthcare in America.
Like what?
Like, can these giant companies like the UnitedHealth Group, can they be part of the solution?
Right.
Or are they always going to be part of the problem?
Okay, so we've talked a lot about UnitedHealth Group, their structure, how they got so big, all the controversies.
Yeah.
They clearly have a ton of power in the healthcare system. But where does that leave everyone else?
That's the big question, right?
It is.
I mean, their dominance is definitely worrying some people.
Yeah.
Are they using their size to, stifle competition, drive up costs, or
Yeah.
are they putting profits ahead of patients?
I mean, we saw how all those mergers and acquisitions really consolidated their power.
Right.
And all those accusations about data manipulation and overbilling, it doesn't exactly make you trust them.
No, it doesn't.
It's like if one company controls so much, from the insurance to the data to even providing the care.
Yeah, it gets kind of scary.
Doesn't it? It feels like it's just waiting to be exploited.
And who ends up getting hurt?
Regular people?
The
We're the
tasers.
ones dealing with the high premiums, the limited choices.
Yeah.
It feels like the system is more about making money than actually keeping people healthy.
Yeah, it's gotten so complex. It's hard to even understand what's going on, let alone fight back.
So what can we do? Are we just stuck?
I don't think so. I think the first step is awareness.
Okay.
Understanding how these companies work, where the conflicts of interest are.
Right.
Seeing how their decisions affect us.
Okay, yeah, that makes sense.
Once you know what you're up against, you can start demanding better.
Knowledge is power.
Exactly. So what can we actually do?
Yeah, what are some specific steps?
Well, first, support policies that make healthcare pricing more transparent.
Okay.
Find out where your insurance premiums are going.
Uh-huh.
Figure out why the cost of your care keeps going up.
Okay, that's a good start. What else?
We need more competition in the healthcare market.
Okay.
Challenge these mergers that give too much power to one company.
Right, break them up.
Support smaller, independent healthcare providers.
To give people more choices.
Exactly.
Okay, what else can we do?
Don't underestimate the power of your voice.
Okay.
Talk to your elected officials. Tell them your stories.
So they know what's really going on.
Demand a healthcare system that puts people before profits.
That's a good point.
We have to speak up.
It makes you think about those donations that UnitedHealth Group makes, to all those charities.
Yeah.
Is it really about helping people? Or is it just to make them look good?
It's a tough question.
It is.
It's great that they're giving money to underserved communities, trying to diversify healthcare workers.
Right.
But they also have to be held accountable for the harm they've caused.
So it's not enough to just throw money at the problem.
Exactly.
They have to fix the system that created the problem in the first place.
That's what needs to change.
Yeah, and that means changing their priorities.
Right. It's not about making as much money as possible.
It's about taking care of people.
Exactly. Making healthcare equitable and sustainable for everyone.
It's a big challenge.
It is, but I think we're at a turning point.
You do. Why?
I think what happened in 2024, the cyberattack, Brian Thompson's death,
Yeah.
they really shook things up,
Yeah.
exposed the cracks in the system.
And those cracks are getting bigger.
Yeah, with costs going up and access going down, we have to do something.
So where do we go from here?
That's the question, isn't it?
It is.
How does the UnitedHealth Group story continue?
Uh-huh.
And how does that affect the future of healthcare in America?
We'll have to wait and see.
I think the conversation is just getting started.
Yeah, I think you're right.
We'll see what happens.
Well, this deep dive has been eye-opening.
It's a lot to take in.
It is, but I hope it's made people want to learn more
Yeah.
and ask some tough questions about the healthcare system.
That's what we need.
Because we all have a role to play in this.
We do.
We have a voice, we have power,
Don't be afraid to use it.
and fight for a healthcare system that actually works for everyone.
That's what it's all about.
That's all for this episode of The Deep Dive.
Thanks for listening.
Keep learning, keep asking questions, and we'll see you next time.